So there are a number of indicators, and there are a number of physical indicators, and high blood pressure is one, because when our friend the amygdala sounds the alarm, stress hormones get released, blood pressure goes up, respiration is more rapid. The idea is to get air in the lungs, so it's carried in the bloodstream to the large muscles, so we're ready to spring into action to fight for our lives or run away. So we're now in this state of increased arousal. So insomnia. Well, if somebody's suffering psychological trauma, it's replaying in their mind, close their eyes to go to sleep, boom. No distractions, up comes the memory again. Or as soon as they go to sleep, they're having nightmares, so they're waking up. So their sleep can be affected. This can lead to fatigue. But even without that, somebody who's ready to spring into action to fight for their life or run away is tense. Now, if you were walking about tense all day, wouldn't you be exhausted? Let's face it, you would. So fatigue is very common. Headache. Well, if you were to even just momentarily just to tense the back of your neck and your shoulders, you can feel the tension here. Do that for another 5 minutes, you'll have a headache. So headache's very common. Digestive problems. Well, the blood flow is moving away from the vital organs. There's enough going to the vital organs to keep them functioning, but it's now carrying the oxygen to the bloodstream, and so that we're ready to spring into action. Untidy appearance is another. So why would you be interested in your dapper appearance whenever your life is at threat? Sweating and chest pain. So these are very common physical indicators of psychological trauma, but also ordinary everyday stresses. You'll see these as well because we react in exactly the same way. There are a number of emotional indicators. Now, anxiety and depression. So somebody could present with symptoms of anxiety and some people with symptoms of depression, or both, also in response to psychological trauma. So these aren't necessarily standalone. Loss of libido. So having sexual contact or procreating for the survival of the species takes second place. This is about survival of the individual. And loss of sense of humor. Of course, the person has to have had a sense of humor to start with. Irritability and aggression. So often people will be irritable, snappy. So the person who you recognize in the workplace, who used to be pretty laid back, you know, this term, always laid back character, and now he's a bit snappy. You know, and what do you mean by that? Or what? And another one there is, yes, exaggerated startle. Yeah, no, it's a behavioral one. So irritable and aggressive, and particularly in somebody who was never that way before. Sense of apathy, or poor concentration and memory, tearfulness, loss of confidence. A lot of those sound familiar to what we heard earlier. Certainly Linda's story earlier, a lot of those, you heard that, and also in what you're telling us there as well, Nicola. So we'll see a lot of these symptoms. And behavioral indicators, chain smoking. Smoking a lot then depresses the central nervous system, so now person's smoking more. Finish one, start another, finish one, start another. Overeating is another. Loss of appetite could be another. So eating too much or eating too little, which leads to weight gain or weight loss. Excessive drinking, so increased alcohol consumption dampens down the central nervous system and takes the edge off the symptoms. Drug abuse of different sorts. If people are feeling too little, they might be doing cocaine in order to feel something. They might be cutting or burning in order to distract themselves. They could be using heroin, for example, as a depressant too. Poor timekeeping is another. Indecisiveness and forgetfulness. The exaggerated startle. So the exaggerated startle is not just like that. It's the leap out of the skin. And it's usually to unexpected touch or certain unexpected sounds. So working away in the workplace, and then something drops over here, and people go like this, or oh, not such and such, but the one who goes, ah, like this and turns around, who the hell did that? You know, that's an exaggerated startle. So if you're seeing that in somebody, what has happened in the past has put them on edge. Unable to settle, so they sit down, have their tea break or their lunch, then they're up moving about. Or whenever they're at home, they can't settle to sit and watch TV or read a book. So concentration could be affected too. It could be obsessive or erratic behavior. Checking, multiple checking is very common as well. So checking that out or being aware of that if the person's now checking a lot whenever they didn't check before. Or avoidance of people, places, or activities. So I'm not interested in going out to the group outing, or I'll avoid doing different tasks, or, well, gosh, you can never get him or her to go down to that particular part of the workshop now. So why is that? So what should we do post-critical incident? We've only got about a minute and a half left, so we'll go through this. And post-critical incident options, do nothing. So that's one option, but it's not going to help anybody if you just ignore it. Watchful waiting, and that's the advice of the Royal College of Psychiatrists post-trauma. Watchful waiting. Now, why would we have watchful waiting? Well, natural healing can occur. Most of you have probably lost somebody close to you or something that was dear to you in the past. And the pain at the start was maybe horrendous, but now over time the pain has got a bit less. So natural healing can occur. And similarly, post-trauma, natural healing can occur too. So we can teach people strategies to lower the arousal level, to breathing exercises, meditation, things like that. But if we were to jump in straight away, well, there might be reasons to do that, but the guidance would be avoid individual critical incident stress debriefing. Individual critical incident stress debriefing, that can make people worse. It can be harmful. There's a vast body of evidence to tell us that. Assessment and therapy, if appropriate. So we're doing the watchful waiting, and we're identifying that this person has had this incident they've been involved in has had an impact. We're teaching them the strategies to lower the arousal level. We're getting them supported, and we're seeing, is natural healing taking place? And if it's not, they're still having the nightmares, the flashbacks, they're not sleeping even after a week, then we need to do something if we can. And there are a few things that can be done. So medication can be very helpful for somebody who has panic attacks, like propranolol prescribed by the GP can be helpful. Short course diazepam, for example, is another. So again, that prevents them from being addicted to it. Antidepressants, they can be on a course for about maybe 6 months, or some people a bit longer, depending on what's going on. Stress management strategies, and this is because we've activated what's called the sympathetic nervous system. Stress management strategies then activates the parasympathetic nervous system, which counterbalances it. So a bit like a seesaw effect. An employee assistance program, it's really good to have that in place. Supportive counselling is very good, but also if somebody who's not able to go to work and the pay stops, then they need some support too, maybe with debt management as well. And Nicola was referring to that. So the importance of having an all-inclusive support package in place. But there are 2 therapies which are recommended for treating psychological trauma, and learned bodies throughout the world have recommended them. EMDR therapy, which is eye movement desensitization and reprocessing, and then trauma-focused cognitive behavior therapy. So there are many mental health professionals in the NHS who are trained in these, and certainly one of them, and there's various private opportunities as well.